Hello, and today we're going to talk about the difference on the American healthcare system, or what is particular to the American healthcare system that you should know about. Some of them only, not all of them. There are so many, but today I could only think of 5. So let me tell you about them. So by the time that you do a rotation or you have to talk to your attendings, then if you hear one of these words, then you know what's about. Okay, let's start with cures. What is cures? Spells C-U-R-E-S. Cures is part of the Department of Justice initiative, and it's meant to track the use and prescriptions of controlled substances, opioids, right? Why? Because the opioid pandemic is a big problem in this country, and there's a lot of patients that unfortunately go around emergency departments or doctor's offices looking for prescriptions for opioids. Not necessarily for them to use them in treatment of their pains, but to satisfy an addiction or to sell them. So when we use this cures program, what we do is we have a link to a website, then you enter your information and you check for a patient's name, and it gives you a report of the latest prescriptions that these patients had, who gave the prescription, how many pills, and when was this. Why? Because if a patient had a prescription for morphine a week ago at a pharmacy in a different city and is coming now 3 days later to get another prescription for morphine, then you might be suspicious that something is going on. Why? How did you run out of 30 pills in 3 days? What's going on? So that is what cures serve us for. And nowadays, it's mandatory for hospitals, for doctors, for residents to check on every patient's cures report when discharging with an opioid prescription. Okay. Next one is skilled nursing facilities. And this is a big thing because on the part of transitioning to home after hospitalization, skilled nursing facilities are very useful for us to know. Why? Because let's say a patient is too deconditioned to be able to go back to live alone after a hospitalization for a small bowel obstruction. You realize he's too deconditioned, he was only able to walk 5 feet, and this is not his baseline. How is he going to cook for himself? How is he going to get to the restroom? How is he going to take a bath? So there is a need, there's a skill need, like physical therapy, wound care, IV antibiotics, that can only be done under supervision to prevent the patient to get on harm's way. So this is why a skilled nursing facility is there. So you, instead of sending a patient home, you send them to a skilled nursing facility for a brief period of time, transitioning to a skilled nursing facility before going to home. It's something that is not just you ordering for that. You have to discuss this with the patient, saying that this is an idea I have. And what does your family think? What do you think? And if everyone is in agreement, then let's do it. Let's send you there. And once you're improved or stronger, go home. Home health. Home health, it's the same idea with skilled nursing facilities. Is the idea of transitioning to home, how to safely transition to home. So one is skilled nursing facilities, which you go and stay there. But let's say this patient says, I really don't want to go to a skilled nursing facility. I don't want to stay in a different place than it's not my house. I have my family around. Can you send me home? So that's possible. But you realize that this patient still needs physical therapy, that this patient still needs wound care, that this patient still needs supervision on his medications. So you could send a home health agency to do these things to the patient's house. And what you request is what you need. For example, if you need a nurse for wound care, you request home health for wound care at home. So the insurance company that this patient has will send this patient a nurse to take care of the wounds, or to take care of the medications, or to take care of the physical therapy at home. Next one, let's try the next one. Documentation requirements, and this is a very sensitive topic because doctors don't like to be told what to do, but unfortunately in this country, how to say this, in this country, documentation is of utmost importance. If it's not in the chart, then it didn't happen, it wasn't considered, and it can become a liability for you. So first of all, you need to document everything that happens in a patient stay. Medications that were started, discussions that happened, discussions with the family, any abnormal behavior that you saw. That's one aspect. And the second aspect, and which is very important, and it is on how hospitals get paid, and how, and this is why you will be very carefully supervised on your assessment and plan part, is because your diagnosis are billed to a patient's insurance. So let's say you have a patient with sepsis, but instead of saying sepsis, you said this patient had only pneumonia. Then the payment that this patient's care receives is way less than a patient with sepsis due to pneumonia receives. That's why it becomes very important for you to identify certain conditions and link it to a possible etiology. Why? Because a very carefully explained condition has, most of the cases, a higher pay or a higher tire than a simple condition. And we basically, that's how one of our responsibilities as interns, as residents, is to verify or to ensure that there's good clinical documentation and good identification of diagnosis. Next one is the early discharge requirement, and you will see this might take you as something new, but in this country, hospitals strive to have discharged patients early in the morning. There's usually a cutoff time. For my hospital, it's 11 a.m. They always push for patients that are going to be discharged before 11 a.m. I don't know exactly why is that, but you will see something similar in your hospital. So as a resident, when you start, and after finishing morning rounds, you should focus on trying to discharge the patients that can be discharged that day before your cutoff time. And that's it for today. I'm on for another pager call. We'll bring you more information next time.